So we'll be looking at the features, clinical features of acquired syphilis. So when you talk about clinical features, you are basically trying to look at the signs and symptoms. Symptoms is what the patient will complain about. Signs is what you elicit on examination, you know. So acquired syphilis. So what will be there? So we say acquired syphilis because you have the congenital syphilis too. So acquired syphilis, it presents in distinct stages. You have the primary syphilis, you have the secondary syphilis, you have the latent syphilis. They're like that. So let's look at it. The first one is primary syphilis. So the person has been exposed to syphilis, so kind of like 3 weeks after exposure, 21 days. There's single or multiple painless firm round canker at the site of inoculation, that's in the genitals, anus, or mouth. Can you see that? Mouth. Can you see that? Kind of like wounds. So other features is what regional lymphadenopathy. So your lymph nodes around that side, they are swelling. Okay. So maybe sometimes within 3 to 6 weeks, it heals on its own. Okay, but if infection persists, we move from primary syphilis to what? Secondary syphilis. You can pause to observe this. So for the secondary syphilis occurs weeks to months after the canker heals, you know. So there's skin rash, which is usually non-itchy. You can see it on the palms and the soles, reddish brown maculopapular lesions, you know, mucocutaneous lesions, systemic symptoms like the person is having fever, feeling like they're unwell, sore throat, there's hair loss here and there, you know. All right. It's highly infectious stage. Okay. They'll have latent syphilis where the early latent one, the disease is no symptoms. It just goes down again. Late latent, no symptoms. Okay. But it's a risk of if you don't tackle the disease, it progresses to what is known as what? The tertiary syphilis. So tertiary syphilis, 10 to 30 years after you had the infection, you didn't treat it very well. So it's rare. Do you understand? It affects the heart. There's inflammation of the aorta, aortitis, aneurysms, aortic regurgitation. It affects your nerves, tabes dorsalis, general paresis, stroke, gomatous syphilis. So there's granulomatous lesions on the skin, the bone, and the organs. We also have the ocular or otosyphilis. Do you understand? So you have all those, vision loss, you know, and the rest of it. Okay. So I think this is what we have based on the different stages of syphilis. That's clinical features of acquired syphilis.